everyone. In this lesson, we will learn about on-site first aid for construction accidents. According to recent statistics on construction accidents, the 5 most common and fatal types of accidents in the construction industry are falls from height, being struck by objects, mechanical injuries, structural collapses, and electric shocks. In this lesson, we will focus on first aid for the first 4 types of accidents. 1. Falls from height. Victims of falls from height often sustain injuries due to the strong impact force when the body hits the ground at high speed, resulting in damage and trauma to bodily tissues and organs. In many cases, multiple systems are simultaneously affected. After a fall from height, the focus of rescue should be on managing shock, fractures, and bleeding. 1. Immediately organize a rescue effort and assess the injured person's condition, including the location and type of injury. If the injured person is in shock, treat it first. If breathing or heartbeat has stopped, immediately perform CPR. For those in shock, keep them calm, warm, and lying flat with as little movement as possible. Raise their legs about 20 degrees and transport them to the hospital as quickly as possible for emergency treatment. 2. If there are signs of head or brain injury, ensure the airway remains clear. If the injured person is unconscious, lay them flat with their face turned to one side to prevent the tongue from blocking the airway or inhaling secretions or vomit, which could cause airway obstruction. If there are fractures, perform preliminary immobilization before moving the injured person. For depressed skull fractures, severe skull base fractures, or serious brain damage, cover the wound with sterile gauze or a clean cloth. Bandage it with gauze or cloth strips, and immediately transport the injured person to a nearby hospital with appropriate facilities. 3. If a spinal injury is suspected, cover the wound with sterile gauze or a clean cloth and bandage it with gauze or cloth strips. When moving the injured person, lay them flat on a rigid board to avoid shifting or breaking the injured spine, which could cause paralysis or death. During transport, do not lift the injured person by their shoulders and legs or carry them on one shoulder. 4. If the injured person has a fracture in the hands or feet, avoid moving them recklessly. Temporarily immobilize the fractured area with a splint to prevent further displacement of the broken ends or injury to muscles, nerves, or blood vessels. Immobilization method. Immobilize the joints above and below the fracture site. If no splint is available, use local materials such as wooden boards or bamboo. If materials are not available, secure an injured arm to the side of the body or bind the injured leg to the uninjured leg. 5. For injuries with traumatic bleeding, immediately apply a bandage to stop the bleeding. Position the injured person with their head lower than their feet and keep them warm. 6. Use the fastest available transportation or other means to quickly transport the injured person to the nearest hospital for emergency care. Minimize shaking and jolting during transport. Additionally, closely monitor the injured person's breathing, pulse, blood pressure, and wound condition. 2. Struck by objects. Struck by objects refers to injuries caused by the inertia of uncontrolled objects, including injuries caused by falling objects, flying debris, and collapsing structures. After a struck by objects accident, the focus of rescue should be on managing head injuries, chest fractures, and bleeding. 1. After an accident involving an object strike, on-site rescue personnel should first check for any remaining falling or flying objects. Immediately take measures such as evacuation, installing protective nets, and shutting down power equipment to prevent further injury during the rescue process. 2. Carefully remove any objects pressing on the injured person. If the injured person is in a dangerous or inaccessible location, they must be moved to a safe place where rescue can be carried out safely. 3. Observe the injured person's condition, including the location and type of injury. Choose appropriate first aid measures based on the type of injury, following the same procedures as for falls from height. 4. Seriously injured individuals should be immediately transported to a hospital for treatment. Use a stretcher to transport critically injured patients. For abdominal and spinal injuries, use the supine position. For chest injuries, the supine position is generally recommended. For head injuries, the injured person should be placed face up with the head tilted to one side or in a side-lying position. 3. Mechanical injuries. Mechanical injuries are usually caused by the direct physical effects of machinery, such as crushing, cutting, impact, or entanglement. These injuries are often complex and may involve multiple types of trauma. After a mechanical injury, the focus of rescue should be on handling head injuries, chest injuries, and life-threatening internal organ damage, such as liver and spleen rupture, before treating limb bleeding and fractures. 1. After an accident, if it's safe to do so, immediately cut off the power supply and stabilize the machinery involved in the accident to prevent further injury. Carefully free the injured person from the machinery as soon as possible. If necessary, dismantle the equipment. 2. Observe the injured person's condition, including the location and type of injury. First, check consciousness and breathing. Next, check the pulse and heart sounds and examine the pupils. If possible, measure blood pressure. Check for local injuries, including wounds, bleeding, fractures, and deformities. Based on the injured person's condition, apply appropriate emergency measures such as artificial respiration, chest compressions, bleeding control, bandaging, and immobilization. 3. If the injury involves a sharp object causing a cut, make sure to safeguard the severed tissue and bring it along with the injured person to the hospital for medical care. If the injured person is in severe pain, administer painkillers or analgesics if available. 4. Structural collapses. Casualties from structural collapses are usually caused by crushing, burial, impact from heavy objects, or secondary hazards such as explosions, electric shocks, and asphyxiation. These accidents are characterized by a high fatality rate and multiple system complex injuries. During rescue operations in a structural collapse, priority should be given to treating life-threatening injuries caused by crushing, burial, and secondary hazards, with special attention to crush syndrome, asphyxia, and traumatic shock. 1. When a structural collapse occurs, immediately notify professional rescue teams. Assign a person to promptly shut off valves and power supplies and cordon off hazardous areas. Conduct emergency repairs, reinforcement, or demolition of unstable structures to prevent further collapse. 2. Based on the specific situation, use a combination of manual clearing and mechanical excavation, such as digging or drilling, to manage the collapse site. Establish ventilation, communication, and water supply channels during the operation. 3. After rescuing victims from the surface of the debris, immediately begin searching for those trapped beneath. When approaching trapped victims, manual excavation should be used to avoid causing secondary injuries with heavy equipment. When a buried person is found, avoid forcibly pulling them out, as this may worsen their injuries. 4. After rescuing a buried person, move them to a safe location for on-site emergency care. Immediately clear any foreign objects from the victim's mouth, nose, and ears. Check for breathing and heartbeat. Breathing and heartbeat are absent, immediately perform CPR. 5. If bleeding is present, apply immediate pressure and bandaging to stop the bleeding and clean the wound to prevent infection. For limb fractures, promptly immobilize the injured limb to prevent further damage to surrounding tissues. If emergency rescue is not possible on site, quickly transport the injured person to the nearest hospital for treatment or wait for professional medical personnel to arrive. That concludes today's lesson. See you next time.